It's been quite a week, and we are wrapping it up. It's 9 News Heart Week, and earlier we heard Carol's story, all about being diagnosed with heart failure. Actually, more than 5 million people in the United States have been diagnosed with heart failure. And about half of them will die within 5 years from heart failure. There is a hopeful side to this, though. For more, we send it over to 9 News medical expert Dr. Camilla Sasson.
I'm joined here by Dr. Ira Dauber, who is an interventional cardiologist and also heads up the heart failure clinic at South Denver Cardiology Associates. So thank you so much for joining us today and helping us cap off our week of Heart Week here. You know, I think what we want to do first is just start with the basics about what heart failure is. Now, we know heart failure is when the heart cannot pump blood effectively to other parts of the body. So what are some of the different types of heart failure and how are they diagnosed?
Well, the two main kinds of heart failure are really heart muscle weakness and what we call a stiff heart. And in both cases, the heart fails to pump enough blood. You know, I think heart failure kind of gets a bad name. Your heart doesn't fail. It fails to pump as efficiently as you need it to. And as you can see from the picture here, there's a normal heart. One side of the heart pumps to the lungs. That's the blue side. One part of the heart pumps to the body. That's the red side. And that's what a normal, efficient heartbeat ought to look like. On the next picture, you can see where the left side, the red side, is enlarged and is pumping more slowly, and that's what a weak heart looks like. So, you know, it didn't fail. It failed to pump as much blood as your body needs it to do, and that's where heart failure comes from. Heart muscle weakness is one of the major kinds of heart failure.
And now we know that heart failure onset is usually around 70 years old, but there's a lot of things that people can do earlier in life to make sure that they can prevent developing heart failure. So talk to us about some of those things that people should be thinking about in their teens, 20s, 30s, 40s even.
Yes, and that's right. Heart failure can be prevented. Heart failure is sneaky. As you heard from Carol's story, a lot of people don't even know they have it. It just happens. But early in life, the weak muscle heart failure is usually caused by coronary artery disease and a heart attack. So the things you can do to prevent that are the healthy lifestyle, diet, exercise, get your blood pressure checked, get your cholesterol checked, try not to have heart artery disease. That's the main cause. The other kind, heart muscle stiffness or stiff heart, that happens is mostly high blood pressure and obesity, overweight. So over time that sneaks up in you and you don't realize it. It affects your heart. So early in life, you can do something to prevent heart failure later in life, but sometimes you get struck and surprised when you're young, and that's hard to avoid.
Well, just like Carol, she was only 48 years old, literally skiing a few weeks prior to being diagnosed.
Right.
You know, so I think one of the things that we know is that keeping patients actively engaged in their treatment is really key in terms of hopefully helping them prevent that progression of heart failure. So what are some of the advances that have happened that help people who've got heart failure?
Well, I think one of the things we've had a lot of new medications for heart muscle weakness type of heart failure, as well as the devices like pacemakers and defibrillators, which you heard Carol got, which can really restore the heart almost to normal function. The heart muscle stiffness is way behind that. We don't have nearly as much to do. But in both cases, part of recovering from heart failure is patients taking an active role in their health. So that they look to diet, they look to exercise, they look to their families for social support, because they're going to recover for the most part. They may have some medications, they may have some limitations, but a lot of people recover to full speed. One of the technologies that we've had that allow people to be engaged, because heart failure is incurable, if you will, but it's very treatable and manageable. So we have these telehealth units that we've provided patients, so from home they can send us their blood pressure, their vital signs, a little message about how they feel.
Phone, right? We spend a lot of time already on
That's right. So they stay engaged on a daily basis with updates, as opposed to coming to the doctor's office every 6 months or so. They're actively engaged on a daily basis.
Well, thank you so much for talking about heart failure. I think it's so very important that we talk about all the different types of heart conditions this week. So thank you so much for joining us. Back to you, Tom and Kim.
Yeah, encouraging. It is.
Yeah, it really
Stay on
is.
it. All right, thank you.